Hi, this is Rachel at livingmom.net, and today I'd like to talk about natural childbirth in a hospital. If you look at the video below, this is an interview with Dr. Mercola is interviewing Dr. Andrew Saul, who recently wrote a book called Hospitals and Health, Your Orthomolecular Guide to a Shorter Hospital Stay. I wanted to relate what he discusses in regards to hospital stays into the birth environment. And so there's two factors that I want to start out with. The first one is that you do not work for your care provider works for you. I think that your OBGYN, your midwife, your family practitioner, whoever is part of the process in the delivery of your birth, is a business. This is someone who is providing you a service and you are paying them for it. Also, hospitals are businesses. Two factors I think we very easily forget because we believe our doctors or midwives are more educated than us, so we tend to listen to them, sometimes above our own intuition. The second factor in regards to birth, and especially hospital birth, that I think it's hard to forget is that you are not sick. You are actually a healthy woman, for the most part. If you're not high risk or have complications, you're considered healthy, and your body is doing a normal physiological process. And so when you enter a hospital, you are entering a space with people who are sick. And one of the first interventions that can take place when you enter a hospital is that they have you put on the hospital gown. In my opinion, that hospital gown represents an unconscious belief that you are sick. And at that point, if you are sick, your whole perspective of your birth experience can shift. And so to remember that you are a normal, healthy woman whose body is doing something that's a normal physiological process will help you to enter this environment and hopefully feel at peace about the experience that you're looking for. So, thirdly, I want to discuss one of the things that he talks about in the video below. How that there is one medical error per day with the majority of people who enter a hospital. So what that means is that that medical error could be happening on you or happening, heaven forbid, on your infant. And so I think it's vitally important that we keep our infants with us, especially after delivery, at all times. Some people take their babies, send their babies to the nursery. I think that if your baby goes anywhere else, it's vitally important to remember that that baby needs you as its parent there with it in order to help protect it from any unexpected testing or things that you might not want done. I think it's vitally important also that you remember that any test that is done on your child, you can absolutely waive. So because your care provider works for you, you're in charge of this experience. You get to say what you want and what you don't want. And truthfully, you can waive anything that you might not want done to you or your baby. I think this is a component of birth that we tend to forget quite easily. I find it interesting in this video as well where he discusses that doctors who are seeing very many patients throughout the day aren't washing their hands in between, only putting on gloves because they're stating then they'd have to wash their hands up to 60, 70 times a day. So even if you have a doctor who's only working with birthing women, if you have another birthing woman who might be sick, might carry some bacteria of some kind, then he's going to enter that birth scene and come into your birth scene. And bacteria is very important, especially to think about when we're dealing with the compromised immune system of infants. A baby is bathed in your germs, and your amniotic fluid is really covered in those germs. And when your baby is born, it's exposed to new bacteria. Now, in a home birth environment, that bacteria is most likely yours and what it's already used to. But when you do enter a hospital space, that bacteria is lots of other people's. And so I think it's important that our babies stay really close to us at all times, especially after delivery. In order to really create the wonderful birth experience that you want, it's important that you educate yourself on what are hospital protocols and routines. I think it's very important that you take childbirth classes that teach you about what those hospital protocols and routines are and what your choices really are. One of my least favorite books on birth is What to Expect When You're Expecting. And the reason that that's one of my least favorite books is because the title says it all. It is written by a doctor who's going to tell you what to expect, that you don't have choices, and you have choices. One of my favorite birth books is a book called The Thinking Woman's Guide to a Better Birth. It's by a woman named Hensie Goer, and it's got the last fourth of the book is thick in resources of where she got her information. And it shows the risks and benefits of a lot of the routine procedures that are done in birth today. I would go and take a tour of your hospital. Start asking questions to your doctor after you educate yourself. I would find out C-sections rates of the hospital and the doctor that you're working with, induction rates of the doctors and hospitals that you're working with. This will give you an indicator of what you can expect in your birth experience. So if your doctor has a 50% C-section rate, then know that you could be part of that 50%. Second of all, I'm a huge proponent of doulas. Doulas are labor support that help you to understand kind of what's going on in the birth environment. They've educated themselves about what the hospital protocols are, and they're there to support you in what you want. And so I think it's vitally important that you have that support team. In fact, he talks about in this video that even if you're just going in for surgery, that having a support person there really helps for comfort and well-being of the person who is being taken care of in the hospital. Thirdly, I think it's vitally important that you create a birth plan. Now, this birth plan I think needs to be written up beforehand, distributed to everybody who's involved in your health care, to the nurses, to your doctor, and make sure that they understand that it's important for you. Again, you can waive anything. So if there's something that you don't want, please remember that you can waive it. Fourth, just some questions that you can be asking yourself. One, and asking your care provider. And remember again that you can say no to anything. But some of the questions are, how long can you labor before use of interventions will be offered to you? Can you walk during labor? Do you have to have an IV? Do you have to have a Heplock? Can you labor in water? Can you birth in water? Can you or your husband or partner catch your baby? Can you catch your baby? Can you have intermittent fetal monitoring instead of consistent fetal monitoring? Studies are showing that intermediate fetal monitoring is just as effective as consistent fetal monitoring. How long can you hold your baby after delivery? Every test can be done, even with the baby in respiratory distress, with the baby next to mom. Mom supporting, comforting, helping that baby. Will they delay cord clamping? Do they need to suction? Can you do skin to skin or kangaroo care right after delivery? And how soon after delivery can you go home? So these are just some ideas of things that you can do to help you in your birth experience. I hope that these ideas are helpful for you, and that really one thing I think that's vitally important that we remember is that education plus inspiration really does equal intuitive living, and especially intuitive birthing. Until next time, bye-bye.